or spiritual is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum and welcome to another exciting and educating edition of the Health and Fitness Show. I'm your host Fahad Matin for today's show, and I hope and pray that all of us are fit and healthy by the grace of Almighty Allah. I do pray that we all had a nice and positive week so far, and looking forward for a nice chillaxing weekend. Yes, indeed. We all love weekends, don't we? Even in this lockdown. This program is broadcasting live from the studios of Inspire FM today on 18th of February 2021. Wow, the February is almost done. And casting its positive vibes to all our lovely people in Luton and all the surrounding areas of Luton, like Dunstable, Harpington, Bedford, and definitely going through our positive airways, reaching to all our listeners who are listening us online using, if they're listening us through our Inspire FM mobile app or website, or even using our social media platform, like people who can view us on Facebook, Inspire FM Facebook page via Facebook Live link, or Inspire FM YouTube link. And if you're listening us or viewing us over there, hello and good evening to all. Definitely on this show we try to cover at least all different health related topics, and definitely today's topic is very unique because we will be covering two topics, not just one, two topics, because definitely time is very less and there's so many things happening simultaneously in our life other than COVID. So we have to carry on. We have to try to make sure that all things have been covered and people should know what is available for them, and that's what this program is all about, all the informations we can cover. So hence, let's go to our topics today. So first topic, before we which we will be discussing in our first half of the show, which is before break, and the topic is red flag symptoms of cancer. So when and once we come when we once we have a break, and when we come back from the break, that's the second topic, and that's the second half of the show, and that's where we will be discussing our second topic, which is Parentline and ChatHealth services. And definitely all three topics, or in a sense all two topics, both of the topics are very very important. So without further ado, let's start our topic of the show with a positive quote. And I always say this whenever a topic similar to this happens on my show, which is prevention is better than cure. And definitely it is very, very true, especially in this day and age where we are suffering from COVID symptoms and we have to prevent ourselves going outside. We are still stuck in the lockdown. God knows how long, but hey ho, we are what we are. We are in a space where we are, and things are moving along. Vaccination are happening. Since Monday this week, we have now gone to priority review, and can go and have a jab, especially uh, if you are in the shielded list as well, and that includes cancer. And that's one of the reason I've picked up the topic today, which is the red flag symptoms of cancer. But hey ho, it's not me who's talking about this all the way. I have a guest, and yes, I do have a guest, and she's very lovely, very good friend of mine. She's a GP of our local GP, and she's none other than Dr. Saheli Chaudhury. Good evening, Saheli.
Good
Hello.
evening, Fahad. Hello.
How are you today?
I'm very well. Fahad, how are you?
Well, in your presence, always happy because you are my friend. You are Saheli. You are my friend. So, Saheli, for the benefit of our listeners, if I ask you to give a quick introduction about yourself, so they know who you are as well.
So I'm the Macmillan GP for Bedfordshire CCG and the Cancer Care Lead. And this week, the Public Health England have asked to raise the awareness of lung cancer, especially in the era of COVID. So there's a big campaign out there, so that if you have a persistent cough for over 3 weeks, GPs are still there to see you safely. So if you are concerned that you have a persistent cough, which is not COVID, and you're not COVID positive, and it is not going away, then please do get in touch with your GP, especially if you are becoming increasingly breathless, losing weight, or having coughing up blood, which we call hemoptysis. So these are very important messages to get across. Public Health England are running a campaign with advertising on the television and on the radio. This is a very important message to get across, because obviously COVID has been going on for a year now, and will go on for many more months to come. We just
Indeed.
need to be aware of our own bodies and to take care. And any peculiar signs that you feel are different or persisting after, say, more than 3 weeks, then you need to access your GP and get some help and reassurance and get checked over.
Indeed, and this is something which we do not do most of the time, especially in this day and age. We do not look after ourselves. We do not look after our body. We do not listen to our body. So I do like to ask you this: how important for us to know about our body?
So it's very important to know about our own body, because then we would hopefully, if we know what is normal for us, then we could recognise a change. The NHS website itself has so much information which is reliable and trustworthy. Also, patient.co.uk is a reliable website. Also, Macmillan's website, especially for patients who are, during the COVID crisis, may be feeling very vulnerable and feel, how can I get extra help? Macmillan have a support line right across the UK. So there are people there on the phone lines there to help you. And again, Cancer Research UK, very good source of information during the COVID crisis for cancer patients.
And definitely on the topic of that, one of the things which I do like to add is our listeners, which I completely forgot to add. So listeners, if you have any questions or queries regarding our first half of the topic, which is red flag symptoms of cancer, please do give us send your text messages or WhatsApp to 07779481822. I repeat, 07779481822. And definitely we like to hear from you. We do like to know how you think that it may affect you, or if you have any uh, observations or reservations, or some kind of an experience to share. Please do share us either by text messages or WhatsApp, or even if you want, you can use our social media platforms like YouTube or Facebook live link, and do send us a message. We definitely want to encounter your questions and your comments. Right, coming back to our topic now, it is whenever we talk about red flag symptoms, we always say lumps, bumps, and some other abnormality appearing up on our body. So how do we know if the bumps or lumps or some abnormality, my tongue is twisting badly, some abnormality appearing up on our body is not normal?
So some lumps and bumps can change as we get older, but those that you feel are growing very large, becoming uncomfortable or painful, you feel that you're unwell with it or you're bleeding, that they are the ones that you need to go and ask for advice. Seek your GP's advice, and they may initially do a telephone consultation or do a virtual consultation online, because that is the way that the general practice has gone now to keep everybody safe. But if you need examining, your GP is there with their PPE to help you and assess your needs. And then if you need further referral, then the hospitals are still trying their best in these difficult circumstances. We have had some delays in our services because of COVID, but the NHS there, and all its healthcare professionals and staff are dedicated people who are trying to serve everybody with their health needs.
Indeed, and definitely those things are very very important, especially if we want to highlight it or if we want to survive cancer. Because I, being a family member of a person who has survived and then unfortunately passed away with cancer, which is my mom, I am very, very close to this topic myself, and it's her Islamic birthday today, 1 year,
Oh,
2 years anniversary, according to the Islamic calendar date, and I can definitely relate to
mm.
this whole thing, especially when my mom was first diagnosed with cancer, and it was very, very close to my heart, and this and that it's not, I'm not the only one, and there are many people like myself in this world who has lost people who have survived cancers, or their loved one has survived cancers, or gone through this process, and it is not that easy. It is not that easy, trust me. It's a very very hard time, especially. So in terms of the concerns, what are the concerning symptoms of cancer, in your opinion, people should look out for?
So obviously there are many body systems, but the list of concerning symptoms for cancer are usually breathlessness, persistent cough for greater than 3 weeks, coughing up blood, hoarseness or a croaky voice for more than 6 weeks, mouth ulcers that do not heal after 3 weeks, pain on swallowing or food sticking or recurrent vomiting, unintentional weight loss and fatigue, drenching night sweats, bloating, change in bowel habit to looser stools for many weeks, blood in your poo, blood in your wee, new or changing moles that are itching, bleeding, growing in size, odd in shape and colour, and then unusual pain, lumps or swellings that are persisting, sore skin that won't heal, and then for females, irregular vaginal bleeding or spotting between periods or after intercourse, after sex, or after the menopause, and then changes for in breasts, any new lumps that you're concerned of, any skin changes of the breast. So they're the main list of concerning symptoms. That's a long list, but I'm trying to be broad to cover the body systems.
Sorry, I'm just taking a
Sorry.
grasp of breath as well. And I can imagine it is very long symptoms. But then when we see these warning signs, it's not easy, and sometimes we stuck in denial, isn't it? We You as a GP know better than that. If you're having that conversation with a patient, that I just like to send you for a referral, which where we will test the cancer. It is very difficult conversation, isn't it?
So it is a very difficult conversation to have if we choose to, after examination and discussion and taking the history, taking those details and assessing your risk from genetics as well, family history, and whether you're a smoker or drink or overweight. You can modify your risks of cancer by having a healthy lifestyle, eating plenty of fruit and vegetables, avoiding overexposure to the sun. But ultimately, the majority of patients who are put on a 2-week rule referral pathway do not have cancer. The
Mhm.
majority, I would say over 80%, do not have cancer. So that is the statistics. So yes, it is worrying and alarming, but we're so lucky in this country to have an amazing NHS to allow us to fast track those people who we think have those concerning symptoms.
Mhm.
So if you do have those concerning symptoms, check online and have a look on Cancer Research UK or Macmillan's website or NHS's website, and then ring your GP and have that conversation and let them examine you and see if they can put your mind at rest, or whether we do need to take the next step and refer you on the 2-week rule pathway.
Mhm. And yes, indeed, it is very very challenging and very very demanding as well. By the way, out of curiosity, how many types of cancers are there?
Oh, so there's over like 200. I think that's my best guess at the moment. Um, there are many types of cancer.
Mhm.
There's so for every system there is a different type of cancer.
Mhm.
And,
And sorry.
sorry. Sorry, Fahad.
And I must say, it is sometimes very, very mind-boggling, especially when we talk about lung cancer, because lung cancer, with the current pandemic going on, which is COVID-19, it affects our lungs, and you have the pneumonical symptoms and so forth. You have breathing difficulties and things which we normally class as the red light symptoms for cancer, sometimes appearing up in COVID as well, plus
Yes,
minus the whole thing. And that's one of
yes.
the reason I think so. It has been gone as a backbench or something like that, isn't it?
So it's easy to obtain a test now to determine whether you have COVID or not. So if you did have a persistent cough for a couple of days and you were feverish and had a loss of sense of smell and taste, then I would encourage you to have a COVID test to determine whether you have that or not. The vaccine itself will help to prevent COVID, but it's the enormity of the effects of being hospitalized. That's what we're trying to reduce by using the vaccine. So if you are COVID negative and you still have a persistent cough, or you have a persistent cough which you feel is getting worse, or you're coughing up blood, then they're the symptoms that I would definitely say need to be checked over. Unintentional weight loss, where you think, well, I'm losing a lot of weight and I feel really tired, and that definitely needs to be checked over as well, and that could be a sign of lung cancer.
So, in terms of warning signs, which can indicate lung cancers, on rule of thumbs, what do you reckon? And what are the best preventions we have to do if we to safeguard ourselves from lung cancer?
So
As it is
obviously,
the lung cancer, yeah, as it is the lung cancer week, anyways.
you know, people, I think many smokers know that smoking is detrimental to their health, but it is such an addiction. They say that nicotine is 7 times more addictive than heroin, and that's the grasp it has on people. But being a smoker ultimately does affect your risk of developing lung cancer. So if you're a long-term smoker and you're having breathlessness more so than normal, coughing persistently, and then weight loss and coughing up blood, then they're the signs definitely that you need to be checked over. And initially, you would probably have a chest X-ray and see whether anything unusual has been spotted on the chest X-ray. But not all lung cancers are determined on a chest X-ray, and you still may need more imaging for your chest. So, there is a process to go through, but ultimately the best thing that we can do for ourselves, if we're smokers, is try to cut down smoking and to stop. And the NHS does have good support packages still to try and help us quit. And I would definitely encourage that.
And it goes for both smokers of cigarettes, shisha, and cigars, I presume.
And then we don't know as much about vapes, and vaping is better than smoking, but obviously you're still introducing a chemical into your body that we don't know maybe all has been tested, that it could possibly damage your lungs. So we're yet to understand that full process. So I would just say try and avoid them if you can.
Try to avoid abusing our body, because we have abused our body quite a lot anyway, shape or form, on one day basis. And yes, that is a very powerful message, that we have to start looking after our bodies, especially now in this day and age where we know the life expectancy can be a moments away, which, being Muslim, we have been told that yes, you are living now and nobody knows how long you can live. But it is now been proven fact, especially in this day and age where you are alive today, and there are many people we have lost, different age bands, regardless sex, age, caste, where you are in the pecking order. If your time comes, your time comes. Let's talk about the COVID effects of cancer as well. Now, I know COVID affected the cancer and its treatment quite a lot in many different ways, shape, or forms. And some people are still complaining that their treatments are not happening as usually they have. So, what is your uptake? I know Luton and Dunstable Hospital and Bedfordshire Hospital is much better in providing cancer support, isn't it?
So the national screening programs are still continuing during COVID in the second lockdown. So if you are called for your cancer screening program, please attend. So if you're called for your mammogram, please attend. If you're called for your cervical screening, please attend. And if you are asked to do a poo sample for checking of blood in your poo, then please try and engage in that. And I would definitely encourage you to do that. Yes, there have been capacity issues because our anaesthetists and our ITU services have been overwhelmed with dealing with COVID, and they've done such a heroic job. The NHS frontline are doing a fantastic job trying to keep people from dying, quite literally, from COVID. So yes, unfortunately, that has had a knock-on effect because our anaesthetists are needed for surgical procedures for cancer surgery, and there have been some delays. However, we are aware of them, and we are prioritising who needs what treatment first.
That is very, very important. Sorry, I completely forgot sometimes that technology sometimes does play a major role in that sense. And yes, sometimes we do forget that we have to see things through and go for those tests. And on that note, I must say, wow, the time is passing really, really quickly. Just before, yeah, exactly. It's only 4 minutes left to end the show. I just want to double, just before I ask you to give a quick positive message, I'd like to quick touch base on COVID vaccine for cancer patients. Are they okay? Are all cancer patients okay to have COVID vaccines?
So the Macmillan Cancer Support website on macmillan.org.uk has a very good summary about coronavirus vaccine and cancer treatments. So cancer patients I would expect to be deemed as clinically extremely vulnerable. And for the majority of patients, they are safe to have their COVID vaccine. And it is very important that they do have that vaccine. However, if there are some immunodeficiency cancers that are affecting your immune system adversely, you may need a consultant to sign you off to give you the all clear to have your COVID vaccine. But please check out the Macmillan Cancer Support website to get any more in-depth information about COVID vaccine.
And also your GP services are also available
Of
for
course.
you. So
Yes, of course,
if
GP.
if you have any doubts, because your GP do see your history in detail, they know about your computing, about all your medical records. So if there is something, it's best to have a quick word with your GP as well before going for that. And definitely all cancer patients are can have vaccine. The ones who can have vaccines can either book through the national system or have a word with their GPs to get the vaccines. I've been told that all cancer patients have been invited. Is that correct?
Yes.
The ones who can have vaccine. Okay,
Yes.
perfect. On that note, I must say, Saheli, thank you so much for being part of our show
Whistle top
tonight.
store.
Yeah, it is a whistle stop show,
Cool.
and definitely you will be here, and we will again call you on as time passes, because you are one of our friend on the show as well, and we will keep you in check and in link. And on that note, I like to say, if you like to give us a positive message before you go to all the patients who are either suffering from COVID or suffering from cancer.
So the NHS there is there to help you. Your GPs are still able to see you, and you're able to contact them if you need help. If you've got any concerns, anything that's alarming you out of the ordinary, especially from the list of cancer symptoms that I've mentioned, then please seek help and reassurance. Okay?
And definitely, there's always help available. There's always signs available. If you are concerned about anything, as I started my show with a question, that how do we know how important for us to know about our body? You know your body better than anybody else. We know our body better than anybody else. So if you see some abnormality in your body, ask for help, ask for your advice. GPs are still available. It's not, you sometimes you cannot see them face to face. They are available over the phone. Call them, make this appointment. Am I correct, Saheli?
Absolutely correct.
Yeah,
Absolutely
make an appointment.
Absolutely.
don't be concerned or be in denial that yes, it's nothing, it could be nothing. If you think that it could be nothing, definitely it should not be not it should be, so there should be some concerns where you have to follow things through, and definitely and when we have to follow things through, we have to follow things through. But anyhow, that's all for first half of the show. So thank you so much, Saheli, for joining
Thank
us
you.
on this show, and definitely we will be again with you inshallah in future. Thank you, Saheli. So
Thank you
that's
so much.
all. That's all for our first half of the show. So we are going for a break, quick break. So when we come back from the break, we will be talking about our next topic, which will be uh, chat health and Parentline. So stay tuned, and we will be right back after these very, 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 very short messages. So stay tuned. Don't go anywhere.
This program will continue after the break. Continue listening to Inspire FM. Inspire FM.
Inspire 105.1 FM.
Assalamu alaikum. My name is Habib Ali and you listen to Aspire 105.1 FM.
अगर आप वजन घटाना चाहते हैं तो सब कुछ सही करना नहीं, शुरुआत करना जरूरी है। सेहतमंद बदलाव छोटे छोटे बदलावों से शुरू होते हैं और आपको भीतर और बाहर से बेहतर महसूस करने में मदद करते हैं, ताकि आप अधिक स्वस्थ बने और बीमारियों से अधिक मजबूती से लड़ सकें। वजन घटाने में आपकी मदद करने के लिए NHS के पास बहुत सारे सुझाव हैं। खोजिए बेटर हेल्थ। आइए ऐसा करें।
Biscard Pharmacy, your one-stop health and beauty pharmacy in Luton, stockist of over 8,000 health and beauty products. At Biscard Pharmacy, we offer a range of services, including health advice and repeat prescriptions for collection and delivery to your home. We also offer a Hajj and Umrah vaccination. Come in and see us and ask about our stop smoking service. We're open 7 days a week till late, including bank holidays. Biscard Pharmacy, 157A Biscard Road, Luton. Call 457709.
Why do Tops Pizza deliver the top pizzas in Luton? For a start, all the toppings are 100% halal and Tops use fresh dough every day. Then there's the cheese, the highest quality available. And when it comes to food preparation, cleanliness is taken as part of our faith. So that just leaves the taste, choice, and great offers, including buy one, get one free on all medium, large, and extra large pizzas. Tops Pizzas, Wellington Street, LU1 5AA. Order online, topspizza.com or via Just Eat. Download our app or call 01582 72 5000.
If your child's leaving primary school in the summer and moving into secondary education in September, you'll be pleased to know that Moorlands is once again an excellent and exciting independent school option. With small classes and focused tutoring, Moorlands can help your child to flourish and achieve their own personal best. With affordable school fees, half the national average. Find out more about setting your child on the road to a brighter future at kingshousemoorlands.com or call Luton 573376.
Could you look a bus driver in the eyes and tell them your journey is essential? That the thing you think you need to go into the office for couldn't be done from home? Do you always keep a safe distance and wear your face covering over your mouth and nose? The more often you go out, the more likely you are to come into contact with COVID-19. Are you sure you need to travel today? Stay home. Protect the NHS. Save lives.
Winter in Syria is brutal. Excessive snow, sub-zero temperatures and freezing rain cause floods and unlivable conditions. Whilst we see winter as a time for cosy nights by the fire, for many, winter is simply a fight for survival. You can change this by providing warm food, clothes and blankets from just £20. The pandemic will make this the worst winter of their lives. Protect them. Visit sktwelfare.org or call 0300 30 20 786.
بسم الله. قال النبي صلى الله عليه وسلم الدعاء مخ الإبادة. That supplication is the essence of worship.
From the studios of Inspire FM, the time is now 6:30.
Any health advice given, whether general, diet, physical, or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Hello and welcome to the second half of our show tonight, and I hope and I welcome you all to another good second half of our show so far. On this second half, we will be talking about the topic. So before we went on break, we were talking about the red flag symptoms of cancer, and in the second half of the show, we will be talking about two separate topics: Parentline and ChatHealth services. And definitely, it is a very unique topic in itself, because they are services which is available for the community, for our local community, and these services are very, very important and very close to us. So, without further ado, hopefully, and definitely, I won't be talking about the show by myself. So, when a quick catch up in that sense that this broadcast we are broadcasting this show from from the platforms of Inspire FM today on 18th of February 2021, and casting its positive vibes to all our lovely people in Luton and surrounding areas of Luton, like Dunstable Harbour and Bedford, and definitely our airwaves going live and reaching to our listeners who are listening us via Inspire FM app, website, or using our social media platforms like YouTube and Facebook live link. So we are available if you like to get in touch with us, or especially for our second topic, which is Parentline and ChatHealth services. Please get in touch with us by giving us sending your text message or WhatsApp on 07779 481822. Right, on the second half of the show, as I said, this is the second half. We are talking about two very important topics, and those topics are very close to us as well, because being a parent, I know it is one thing which I really like to know is an extra help and support. And definitely, when we talk about extra help and support, we always think about what services are available for me, and when we talk about other things as well, we definitely want to say what are the services available for our kids. um, and we like to see where they are and how things are. And definitely, on this topic, on this note, I'd like to introduce my listener, my fellow my guest. I lost my words. That's what happens in live shows as well. So on this side of the show, we will be talking about two different topics, as I said. So my guest for tonight, who will be joining me today, I've out of those two guests, I have one guest already available with me, which is Kirstie Young, and also hopefully joining me shortly is Alison Braniff. So good evening, Kirstie from CCS, I presume.
Yeah, good evening. My name's Kirstie Younger, and I am a school nurse based at Luton with CCS.
Mm-hmm. So if you don't mind me asking a quick introduction about yourself and definitely about the topic.
So I've obviously worked with the school nursing service for the last sort of 10 years now, and we sort of quite often offer quite a lot of emotional wellbeing support to the young people in the community. And ChatHealth was sort of introduced to us about 3 years ago as a way of reaching out to the young people in the community via an anonymous texting service. You're on mute.
Sorry, I was trying to get in touch with Alison as well, because Alison is joining us as well. So I was trying to get hold of her when we are live. So let's while Alison can join us shortly, I will let's start with you regarding ChatHealth. So can
Okay.
you please tell us about ChatHealth, Kirstie?
So it's a confidential text messaging service that enables young people to contact their local public health nurses, which is us within the school nursing team. Its target audience is young people between the ages of 11 to 19. The young people can receive confidential support on physical and emotional well-being needs and any sort of hot topic teenager topics such as bullying and sexual health.
And definitely bullying is something which is very, very unique area, because that's especially in this day and age where people are going through emotional turnovers. Kids are online, they spend most of their time online anyways, isn't it?
Yeah, that's right. We sort of have noticed a big shift in the way young people are accessing wellbeing support. So we're trying to keep up with the young people by making it a sort of anonymous service for them. Quite a lot of people text in about bullying issues, and quite often if they feel confident enough to tell us what schools they go to, we can liaise and be a bit of a go-between between them and the schools to try and help resolve the situation for them.
Mm-hmm. And in terms of ChatHealth, when did the ChatHealth launch and why?
So ChatHealth launched with us in around February 2018. It's a national initiative, so it has been launched sort of all over the country. We all have different numbers for the young people to text. So it was commissioned in Luton for the young people in around February 2018, because when we go on young people's forums, they're sort of saying that they would like some sort of anonymous service to access wellbeing support. So it seemed like an appropriate service to offer, really.
Mm-hmm. So when they use this service, what is their outcome? How do they reply? What is their how do you say about their experience? Can you share some of those things with us, please?
So we put our phone numbers out in all the local schools and within the local community, and they text in. As I said already, it's anonymous, so they don't have to tell us who they are. They sort of share with us what their issues or concerns are, and then we either offer them emotional wellbeing support through texting them back, or we can arrange to see them face to face if they're comfortable to do that, or we can signpost them to online services that will support them with whatever issue they've sort of texted in with.
Mm-hmm. So, in terms of other area, when we talk about ChatHealth in general, how successful the service is in terms of the users? Do they come up with a good reply, or do they find out whether the service is helping them in any way, shape, or form?
So we text out after we've finished the conversation with them, or if we've seen them face to face after that's been completed, and we ask them for some feedback. And generally, the feedback that we're receiving is very, very positive, and saying that the young people are saying that we are meeting their needs through this anonymous service.
Mm-hmm. So, especially, what are the impacts of impact has the ChatHealth campaign, and especially during this pandemic? Because as we know, during this pandemic, people can't meet each other. Children can't, especially with now schools are closed. The social distancing measures are in place. The only way young kids can interact is using games and so forth. So, what is the impact we can talk about?
So we've noticed it's been quite difficult to sort of publicise ChatHealth, because our main forum is schools. We've asked the schools if they can sort of publicise it on their sort of their Show My Homework websites and stuff, to get the message out there to young people who we are and how to access us for support. We have seen a slight increase in the number of young people messaging us since the pandemic. We're not in a position to offer some face-to-face support at the moment for these young people, but we can offer them telephone contact if that's what they want as well. But we have seen an increase. Most of them are texting in at the moment around emotional well-being issues, concerns about social isolation, and sort of a higher range of self-harming as well at the moment. So we're supporting young people around those topics.
And on that note, I like to involve our listeners as well. So listeners, if you have any questions or queries regarding our topic tonight, please get in link with us by sending your text messages or WhatsApp on 07779 481822. I repeat, 07779 481822. Or you can send your message via text message or via our social media platform on via Facebook live link as well as YouTube live link. And I have our second guest joined in, and apparently it was a bit kind of a struggle, and IT, unfortunately, technology sometimes do give us challenges, especially on our best days. So let me introduce our second guest, Alison. Welcome to Health and Fitness Show. How are you today?
Hiya, Fahad. I'm fine, thank you. Sorry about that. Sorry about the technical issues.
It happens. It happens. Look, in the first half, I was muted and I was speaking, so it happens quite often. Anyways, and apologies. I really wanted to take your call and help you, guide you, but I was in the live show as well at that time. Anyhow, if you don't mind me asking you to give a quick introduction about yourself with the full name for our listeners who are listening us today. So if you give a quick introduction about yourself, and then we will talk a bit more about Parentline.
Yep, sure. Okay. So my name's Alison Braniff, and I'm one of the health visitor team leads working in Luton with the 0 to 5 service. I've been working in Luton for quite a few years, actually, so I do know the population quite well.
Yes, indeed, and definitely, 0 to 5 service is a very important service, because whenever there is anything to do with kids and especially with the children's issues, you guys are there to help us and support us. When I say us, means parents like ourselves. So in terms of the Parentline, and that is our topic. What is Parentline?
Okay, so Parentline, it's a confidential texting service for parents to call in for children aged 0 to 19. And it's a way for them to contact the health service, for them to seek advice, for us to be able to signpost them onto further services, and for us to be able to refer on to either a health visitor or school nurse if we feel that's appropriate. When they contact us, they have a 24-hour. We have a 24-hour response time to respond to them back, and it's open between 9 and 4:30 Monday to Friday. We're not around at weekends, unfortunately. And when the parent sends the text message into the service, they get an automatic reply to say that we've received the message and we will be in touch with them within the 24-hour time frame. So they know that they're going to get that feedback and that their question will be answered.
So one of the things, because I know about Parentline, because I work in the NHS and I come across a couple of times, but for the information of our general public, when did Parentline launch in Luton and why? What's the reason behind it?
So Parentline launched in Luton at the end of June. It's about June the 29th last year, 2020. So right in the middle of the COVID pandemic. And it's been around for a little while. It's been around nationally, and it's worked very successfully in other parts of the county. So I think Norfolk and Bedford have used it quite successfully. So we thought it would be a good service to introduce into Luton for another aspect for parents and carers to be able to contact us. And we know that parents and carers use text messaging much more regularly, and they respond much more readily to text messaging. So that was one of the reasons why we introduced it. We did do some service user questions and got some feedback from service users, and they thought it would be a good service to introduce to our services.
Mm-hmm. If I'm not mistaken, originally I believe Parentline was due to launch in autumn of 2020, but it was has the launch date brought forward for some reason or something?
I think it was that big COVID reason that why it was brought forward. We yes, you're right. It was meant to start around about autumn time, but we brought it forward because a lot of our face-to-face contacts obviously had to stop. A lot of our baby clinics that we had for people to come in and drop in to see us had to stop. So we thought we'd introduce this other service so that people would be able to have another media of being able to contact us rather than us having to be able to go out and see them face to face.
So what is the impact of this campaign?
Brought forward for that reason, really, because we wanted another platform for parents to be able to contact us.
So what impact has the campaign, especially during this COVID pandemic? Is it good? Is it better in some way, shape, or form? Did parents call you more because kids are making them more crazier than usual?
To make them more stressed.
Yeah, and indeed.
It's been a bit of a slow start, I have to be honest. But I must say, over the party, we're seeing more and more parents texting in, asking for advice, particularly our.
I think so, Alison. I'm losing you.
Haven't had so much of that contact at a baby clinic, so.
Sorry, I lost
Sorry,
you,
can you hear me?
Alison. Yes. Alison?
Do you want me to repeat that?
Yes.
Yeah. So what
Yes,
I
please.
was saying was that we have yes.
It happens. Yeah, it's like the signal is slightly dropping on your side, but hey ho. Anyhow, it is what it is. So sorry if you just give a quick one. I think so. I've lost Alison. But anyhow, yes, and definitely sometimes it is very very unusual, especially these kind of services available and patients. So let me come back to Kirstie first. So Kirstie, you tell me please. How your people reply back when I say people, as in how good it has been taken up by the kids itself to come back in terms of text messages. Do they come back? Do they reply back when you reply back to them and try to concern their things? And how successful you think that it will be among the kids?
So yeah, so those young people that do text in, it's a similar response time to Parentline really, and the sort of services sort of complement each other, and we run them in a similar way. So we send them the bounce back to say that we'll be replying within 24 hours. We run similar open times to Parentline, so between 9 and 4:30, Monday to Friday. There have been occasions during the COVID pandemic where we have decided to keep it open over the bank holidays. So there has been one of us answering the text messages over the bank holidays. We tend to notice in the pandemic, the texting is more later on in the afternoon or when kids are due to finish school, and that's normally the busiest times for them because they're not obviously allowed to be texting during school hours. But their responses are pretty quick actually. If they text you with a message, we text them back, they normally respond. That it's almost like they're sitting waiting for that answer. So the response has been quite good. The uptake has increased over the last couple of months. It was quite slow to take off to begin with, but we are receiving sort of on average 3 or 4 texts a day now from young people, and we are noticing that young people are coming back. So sometimes it's the same young person coming back with a new issue, accessing for support again, and they're quite open and honest to say, I've used you before, or I've sort of passed your number on to friends. So we are seeing sort of repeat people using the service.
And definitely these kind of things does have a very powerful impact on young people, and definitely on parents as well, when we're talking about parent line, and when we say about texting. So do we see a common theme, and I'm opening this to both you, Kirstie, and Alison, that do we see a common theme between the themes of questions which we receive from parents or from kids regarding the issues?
So from the young people's point of view, there is common themes. It's emotional well-being, mostly around sort of self-harming issues are the most common things that are coming through. And we are seeing an increase in people contacting us around sexual health issues as well, because obviously they're not sure what sexual health services are open at the moment, how to access sexual health services. So they're contacting us for those kind of sort of support and advice, and we're sort of signposting them onto the right services for that specialist support.
And what about you, Alison? Alison,
Yeah,
are you with us?
so from Parentline, we're getting a lot of calls, as I said earlier, from. Can you hear me? I'm here.
Yep.
Can you hear me?
I think, yeah, I think so. Your reception is slightly delayed.
So as I was saying earlier, okay, probably because.
Yeah, sometimes it happens when we have
Using calls from parents about wind and colic and feeding.
Sorry, saying something. Yeah, please.
Text messages about feeding, wind, starting solid foods, behaviour, information about. People want information about behaviour, when to start toilet training, development, all those sorts of things we get are quite common themes.
So, wow, the time has passed really quickly. We just have under 3 minutes remaining before the end of our show. So, can you please able to give a quick message to our listeners before we end our show? Let's start with you, Kirstie.
So it's really just use the service. So text in any worries or concerns, or any problems you may have, no matter how big or small you may think they are. There is a health professional at the end of that text for you to offer you advice and support for anything.
And Alison? Alison?
I would say the same, just to let you know that we are there at the end of the text message. If you want to give us a text through, we will respond to you with as much advice as we can give you, and just to make sure that you use the service. And can I give you the text number?
Yes, please.
So the Parentline text number is 07507 to answer your queries from the 0 to 5 team.
Sorry, can you repeat? I think so. I've lost you halfway through. It's 07. And if you want to have more information, you can always go to the website.
331 886.
Yep. And if you know if you'd like to have more information, you can always go to online and have a look about this whole services. So that's all for tonight, folks. And I must say thank you so much to both Alison and Kirstie today for joining us today and being part of the show and giving us a very good and such a nice, lovely information about these two services, which is available for our parents and for our kids. And this is something which I will say to both parents and kids. So before I ask you to leave, very quickly, what next, Alison? When the COVID finishes, will the service still continue, or will it be disappearing as well?
No, we'll always be here. There'll always be health visitors and support staff there to support our young families and our children out there. What that looks like coming to COVID.
Indeed, and definitely, and this is something which we all like to know a bit more. The numbers are right on your screen, as we can see. If you need some more information, parents like myself, please do text and get the help. The help is available for you. And that's all for tonight, folks. Thank you so much, Alison. Thank you so much, Kirstie, for joining us today and giving us very good information.
Thank you.
And that's all, folks, for today. Thank you so much to both our guests who have joined us and part of this lovely show tonight. And definitely, please do remember us in your duas and keep listening to Inspire FM. We will be back again next week with a new topic and new sections all the way through. So please do remember us in your duas, because we definitely need your duas, and keep listening to Inspire FM. And those services are available for you guys. So please take good care of them. Until next week, I'm your host Fahad Matting saying Assalamu alaikum.
Assalamu alaikum. In Luton and its surrounding areas, it is now time for Salat al-Isha.
Luton और इसके मज़ाफ़ात में नमाज़े